I'm Becky Gerber, owner and lead instructor here at Academy of Dental Practice Careers. As you know, billing medically necessary dental procedures to a patient's medical insurance carrier is becoming a necessity in today's market. Here at ADPC, we have designed a video that is intended to teach you how to fill out the current CMS1500 medical claim form section by section. We are using a simple sleep apnea case study as our example. Now, before we get started, it is our assumption that you already have the required documentation needed to proceed with submitting the claim. First of all, make sure to have your code book. This is the one I use, the NDAS Medical Dental Coding and Fee Guide 6th edition. It is available at medfees.com. If you prefer looking up codes online, here is a valuable resource, ICD10data.com. And finally, if you want to look up the average UCR fees for your zip code, you can go to fairhealthconsumer.org. The software that I prefer to use for generating a medical claim form is from SpeedySoft. You can find that at speedysoftusa.com. I like it because it is reasonably priced and easy to use, plus it integrates well with most medical clearinghouses. Now that we're ready, let's get started. For our simulated sleep apnea case study, we are going to be using a patient named Willard P. Patient. Please remember this is for example only, and we at ADPC highly recommend that you look up your own ICD-10 and CPT codes. Willard P. Patient came in with a chief complaint of fatigue, headaches, and dry mouth when waking up in the morning. He had a sleep study done on January 15, 2016, and the results were negative. The doctor did an assessment of the patient and advised the patient in order to correct the condition, he would need a sleep apnea appliance. At this point, you at the front desk ask Mr. Patient for his medical insurance identification card. For the purposes of this video, I have cut the current CMS 1500 medical claim form into 3 sections. The first section is numbered 1 through 13, and then above the solid red line in the upper right corner, we have the place for the name and address of the medical insurance carrier. Please notice that the third line is left blank, and that is for a suite number, if applicable. Box 1 is marked Other because we are using PPO insurance. Boxes 2, 3, and 5 are for the patient's name, date of birth, gender, address, and phone number. Box 1A is for the ID of the patient or the person that has the insurance, and in this case it is the patient, and that number is found on the medical insurance identification card. Box 4 is the name of the person with the insurance, and box 6 is patient relationship to insured, which is in this case self, and then box 7 is the insured's address and phone number. Box 11 is for the group number or policy number, and that again is found on the ID card. And then box 11A is for the date of birth of the person with the insurance and their gender. And then box 11C is for the insurance plan's name, and that is Petco, which happens to be the name of the employer. Box 10 is asking if the patient's condition is related to an employment accident, an auto accident, or another accident. And for the purposes of this example, we are marking no in each box. Box 12 is the release of information, and the SOF is the acronym for signature on file, and either is acceptable, SOF or signature on file, and then the date. Box 13 is the assignment of benefits. So SOF again for signature on file, and when that is signed, that means that the provider will receive the insurance check. The middle section is boxes 14 through 23. In box 14, we put the date that the patient noticed the symptoms or the date when the problem was diagnosed by either the doctor or the dentist. We also have a qualifier to put in the next box, and in this case we are going to put 431, which designates this information. In box 17, we enter a qualifier for a provider, and we have DN for referring provider, DK for ordering provider, and DQ for supervising provider. We will be putting in DN in our box 17. If you need further information on filling out the CMS 1500 medical claim form, you can visit one of these websites, sfhp.org or lacare.org, and both websites have very detailed information on how to fill out that claim form. Here's box 14, and we put in the date of current illness and then the qualifier of 431, which is designating that September 1st, 2016 is when the illness was diagnosed or when the patient had the onset of the illness. Box 17 is for the referring provider's name and credentials, so Wayne Johnson, MD, and then just before his name we have DN, which means referring provider. In 17B, we have the referring provider's NPI number. In box 19, we put what documents we have available. And for a sleep apnea appliance, we need a letter of medical necessity, a sleep study, and clinical notes or the initial assessment. And when we put something in box 19, we need to put PWK, which stands for paperwork, and then a number or a set of letters. So in this case, PWK 13AA, available upon request at the provider's site. So I'll explain that when we get to box 19, and I'll explain it a little further. Then we have box 20, and that is where we put the lab fee if in fact the insurance carrier considers a sleep apnea appliance a DME, which stands for durable medical equipment. If the insurance carrier considers a sleep apnea appliance DME, then we can now put the lab fee in box 20 and only the lab fee. In our example, it's $165. Once we have done that, we can now drop down to box 32 at the bottom of the claim form, and we put the name of the lab, their address, and their tax ID number or their NPI number. Here's box 19, and we put PWK 13AA, and then that is paperwork, sleep study, available upon request. And then the next one is PWK DBAA, which is paperwork, durable medical equipment available upon request, and then PWK PYAA, which is paperwork, physician's report available upon request. Next to that is box 20, and we mark outside lab yes, because the insurance company considers this a DME or durable medical equipment. We then put the lab charge, and that was $165, and only the lab fee. In box 23, we put the prior authorization number, and that is the claim number or the call number that we received when we called for authorization. In box 21, we put the ICD-10 or diagnosis codes, and these are the 5 codes that we will be using for this example claim. When we put the diagnosis codes in the boxes, box A through E, we list them in order of severity. So the G47 decimal point 33 is first, it's the most severe, and then the G47 decimal 30 is second, and then so on. Above the D box, we actually have the ICD indicator, and we have 0 for that, and that means that we are using ICD-10 codes. The CPT procedure codes that we'll be using on this claim are E0486 and 99242. So we will be working with boxes 24A through 24J, and if you need any further procedure codes, CPT codes, or ICD-10 codes, you can look at the website icd10data.com, and that's very good. But the 99242 is the equivalent of the dental codes for the clinical oral evaluations, and the E0486 is the sleep apnea appliance. Here it is on the claim form. With 24A, we put the date of service and the from and the to, the month, day, and year. And then 24B is the place of service, which will always be 11 for the office. And then 24D, we have the code number for the exam, 99242, and then the code number for the sleep apnea appliance, E0486. Now we're going to talk about modifiers, and a modifier is a code that modifies the original CPT code. So with the exam code, we are going to be using the modifier 25, which states that the treatment is provided on the same day as the exam. And that's provided that the exam has not been billed in the past. Then we'll use the modifier NU for the code E0486, and that designates that this is a new appliance. For box 24E, we are going to put in diagnosis pointers, and diagnosis pointers are listing the ICD-10 codes in order of severity. So in the first box for the exam code, we're going to be listing A, B, C, D, and then in the second box of 24E, we will be listing A, B, C for the second procedure. And here it is under modifiers, 25 for the exam code and NU for the sleep apnea appliance, and then the diagnosis pointers A, B, C, D, and then A, B, C. In box 24F, we put the charges for the services, and then box 24G, how many we did. For instance, if we did 1 sleep apnea appliance, we put 1. Now this is for example only. If we did 2 sleep apnea appliances, in box G we would put 2, and that number would then be multiplied by 3,800, and we would come up with 7,600, and that would be the number that goes in box F for the fee for the sleep apnea appliance, because we did 2. In box 24J, we have the rendering provider's NPI number. And then we drop down to box 25, and that is the tax ID number of the rendering provider. Box 27 is the assignment of benefits. We click yes, we accept the assignment of benefits, and then box 28 is the total charge. Now back in box 25, we are also letting the insurance company know if this is the Social Security number or the tax ID number. At the bottom, box 31 is the signature of the provider, and signature on file, or SOF, is acceptable, and the date. And then box 32, as we discussed earlier, is the name of the lab that fabricated the sleep apnea appliance, and their address, and their NPI number, and their Social Security number. And then finally box 33, which is the name, address, telephone number, and NPI number of the rendering provider. If you need to know more about documentation or medical billing for dental procedures, we have an introductory medical dental insurance billing and cross-coding course online at adpc.edu20.com. We also have a one-day hands-on class at our San Diego training facility. You can visit dentalpracticecareers.com for more information. And as always, here's to you and your success.